Welcome to the MTQIP 2026 Definition Updates video. This video provides a concise review of the changes for 2026 admissions. The first part reviews changes implemented by the NTDS. The second half pertains to MTQIP-specific changes and clarifications. Before we begin, let's review the format key. A variable name with the yellow highlight signifies a new variable or definition. Red text signifies verbiage that varies from the NTDS data dictionary. Text with a strike-through signifies deleted or retired verbiage. Black bookmarks with a database icon indicate vendor-related changes for action or attention. Red bookmarks with a computer code icon indicate analyst-related changes for action or attention. If you'd like to spend more time on a variable, please pause the video to review the data. The next section of slides includes 2026 NTDS updates or changes also incorporated by MTQIP. Patient inclusion criteria has verbiage changes to exclude patient injuries sustained at your facility after initial ED or hospital arrival and before hospital discharge, and all data associated with that injury event. This is noted in yellow highlight on the next slide. Please note the highlighted area for inclusion criteria changes mentioned in the last slide. Description verbiage for gender-affirming hormone therapy has been changed from taking hormone therapy to taking gender-affirming hormone therapy. The data element of protective devices has been changed to include child car seat, infant car seat, and child booster seat to element value 6 or child restraint. Intubation prior to arrival has a slight verbiage change from the patient was intubated to the patient is intubated. The NTDS data element of primary medical event has been changed from examples of medical events occurring prior to mechanism of injury to inclusive medical events. MTQIP has reached out to TQIP and confirmed that the medical events of stroke, myocardial infarction, cardiac arrest, intracranial bleeding, and sepsis are inclusive for reporting this data element. Current smoker has been updated to include patients who report inhaling nicotine by smoking cigars, pipes, cigarettes, e-cigarettes, vaping, or juuling. Vaping and juuling includes vape pens, dab rings, mods, pomods, or any other electronic delivery system used to inhale nicotine. The time frame for reporting has been changed from within the last 12 months to within the last 30 days. Functionally dependent health status has been updated to include ventilator dependence in collection criteria. For the data element of peripheral arterial disease, NTDS has made changes to their inclusion criteria that match current MTQIP reporting. The only data dictionary revision is changing the red MTQIP specific font regarding reporting PVD under inclusion to black. If a patient meets criteria for ventilator dependence, please also report the pre-existing condition of functionally dependent health status. NTDS has created a new data element of unplanned return to the operating room. This excludes initial unplanned OR visits as previously reported. Unplanned is defined as an acute clinical deterioration requiring operative intervention. MTQIP is also including this data element to stay in line with TQIP. This data element excludes planned return procedures, pre-planned multi-stage approach procedures, procedures performed in an interventional radiology suite or in a hybrid operating room where the intervention is limited to a percutaneous approach. The remaining slides relate to 2026 changes made by MTQIP. Trauma center hospital names are updated annually to reflect system changes. When reporting patient's telephone number, Please report their cell or mobile phone number when available. For procedure start times, if a patient undergoes angiography, report the start time as the time the needle is inserted into the groin. Bronchopulmonary dysplasia or chronic lung disease is being retired as it is only to be reported on patients less than 15 years of age. This does not meet MTQIP collection criteria. Alcohol screen collection has been updated to include the medical examiner's office as a facility involved in treating the patient event. Alcohol screen results has been updated to include levels reported in autopsy if the rest of capture criteria are met. This would include patients who expire within 24 hours of first hospital encounter, and the autopsy screen is the only one performed. Anticoagulation therapy has been updated to include factor XIa, inhibitors, or similar agents. Medications and treatments are changing rapidly, and MTQIP is attempting to capture the true treatment a patient is receiving. Apixaban was missing from the timeframes grid, so this has also been added. MTQIP is maintaining the historical data element of unplanned visit to the operating room. Due to the new NTDS data element of unplanned return to the operating room, changes have been made to the inclusion criteria for reporting this data point. In this updated data element, patients with an unplanned return to the operating room will now be excluded. Several changes are being made to the antibiotic data elements for open fractures due to frequent collaborative questions and change suggestions regarding the difference between MTQIP and TQIP reporting criteria. For antibiotic type 1 and 2, changes have been made under description from IV antibiotics administered to the patient during EMS transfer from scene through 24 hours of arrival at your hospital. 2. IV antibiotics administered to the patient within 24 hours after injury. Changes to antibiotic type 2 reflect the same changes just discussed for the antibiotic type 1 data element in the previous slide. This now includes patients who receive antibiotics administered within 24 hours after injury for patients receiving combination therapy. Antibiotic administration date has been changed to include IV antibiotics administered to a patient within 24 hours after injury. If first administered by EMS on transport to your facility, report as Index Hospital ED or hospital arrival date. If administered at a transferring facility, report the date given if known. If administration at outside hospital is unknown, report as Index Hospital ED or hospital arrival date. Antibiotic administration time has been changed to include intravenous antibiotics administered to a patient within 24 hours after injury. If first administered by EMS on transport to your facility, report as Index Hospital ED or hospital arrival time. If administered at a transferring facility, report the time given if known. If administration at outside hospital is unknown, report as Index Hospital ED or hospital arrival time. Several traumatic brain injury processes of care data elements have been retired for 2026 admission cases. This includes the first ED or hospital INR. The first ED or hospital PTT is being retired. The first ED or hospital anti-10A activity is being retired. The type of first therapy is being retired. The date of first therapy is being retired. The time of first therapy is being retired. MTQIP is adding some new data elements in line with the open collaborative regarding opioid use. These elements are only to be reported on patients greater than or equal to 15 years of age. The first new data element is prescription opioid use. Please report on patients who report prescription opioid medication use within 30 days prior to injury. Examples include oxycodone, hydrocodone, morphine, and fentanyl. Exclude medications used to treat opioid use disorder. Please pause the video to further review the additional information. Reporting date starts July 1, 2026. Substance use disorder refers to documentation in the patient's medical record, either prior to injury or during hospitalization, that is consistent with the diagnostic criteria for opioid use disorder. This may include a formal diagnosis of opioid use disorder or descriptive information indicating a pattern of opioid use that aligns with opioid use disorder criteria. For example, opioid use with cravings and withdrawal symptoms or repeated unsuccessful attempts to cut down or stop use. Exclude patients who only have a positive or unconfirmed positive drug screen. Please review the provided link for diagnostic criteria for opioid use disorder under Resources. Reporting date starts July 1, 2026. Medication for opioid use disorder should be reported for patients who report use of medication for opioid use disorder within 2 weeks prior to injury. Medications that meet inclusion criteria include buprenorphine/naloxone or buprenorphine, methadone, or naltrexone. Please pause the video to review the data under Additional Information. Reporting date starts July 1, 2026. Further information regarding medication for opioid use disorder can be found in the drug search link under Resources. Discharge acetaminophen is to be reported for patients discharged with a prescription or instruction to take acetaminophen. Only report if substance use disorder, opioids equals 1 or yes. Pre-existing medication for opioid use disorder equals 1, 2, or 3. Or if pre-existing prescription opioid use equals 1 or yes. Exclude medications where acetaminophen is part of a combination medication such as Norco, Percocet, or cold medicines. Reporting date starts July 1, 2026. Discharged nonsteroidal anti-inflammatory drugs is to be reported for patients discharged with a prescription or instruction to take a nonsteroidal anti-inflammatory drug. Only report if substance use disorder opioids equals 1 or yes. Pre-existing medication for opioid use disorder equals 1, 2, or 3. Or if pre-existing prescription opioid use equals 1 or yes. Reporting date starts July 1, 2026. Discharge naloxone is to be reported for patients discharged with a prescription for naloxone or instructions on how to obtain it, for example through a pharmacy, community program, or standing order. Only report if substance use disorder opioids equals 1 or yes. Pre-existing medication for opioid use disorder equals 1, 2, or 3. Or if pre-existing prescription opioid use equals 1 or yes. Reporting date starts July 1, 2026. Discharge medication for opioid use disorder is to be reported on patients discharged with medication for opioid use disorder prescribed or continued at discharge. Only report on patients where substance use disorder opioid equals 1 or yes, or pre-existing medication for opioid use disorder equals 1, 2, or 3. Medications that meet inclusion criteria include buprenorphine/naloxone or buprenorphine, methadone, or naltrexone. Please pause the video to review the data under Additional Information. Reporting date starts July 1, 2026. This slide is a continuation of the previous discharge medication for opioid use disorder. Please refer to the drug search link under Resources as needed. Thank you for watching. We hope you found these updates useful.